guys, I'm Angela. I'm a registered dental hygienist in Boston South End, and I work for a biological dental office. And today I'm going to be going over the use of ozone in the dental field. So ozone is this thing that we use that is actually O3, so it's an oxidative that's actually negative, so it's attracted to positive. Many infections are positive, so what happens is this negative ozone is attracted to these infections and it does a good job of getting rid of things, so it's very antibacterial, antiviral, antifungal. This is what makes it ideal for periodontal therapy, which is more about what I'm going to go into since we're talking anything pertaining to hygiene. So for patients that need deep cleanings, so scaling and root planning procedures, we like to use ozone with those procedures because this is a better option rather than just using PerioChip or Restin or like an antibiotic to fill those pockets to kill that bacteria. It's more beneficial for our patients to be using ozone so they don't build up a resistance. There's no antibiotic resistance with it. It's very good for caring with periodontal disease. There's two subtypes to periodontal disease. You have gingivitis, which is the first subtype. This is inflammation of the gingiva. This is also reversible, so this is kind of the first stage. Then we get into periodontitis, which is the loss of bone. This is irreversible, so us hygienists want to prevent that from happening. So in these deep scaling procedures, what we do is we go under the gum line, we really clean out that bacteria, just mechanically with our electric scalers, our hand instruments, but afterwards we do still need something in there to help these gums heal back up to the seal right next up to the tooth. So like I tell most of my patients, what's really great to have with flossing is we go under there, we really get that floss in, we open the gum up, we get oxygen delivered into the gums. That's really what brings the inflammation and bleeding down. So same thing with this ozone. It has a lot of that oxygen. That's really what's going to heal that gum up after we remove all the debris from under the gum line.
Our office uses the Ozone Generator from Longevity. This machine breaks apart oxygen, the O2, into individual atoms. Then they all attach to the oxygen molecules, which is making O3, which is the ozone.
So typically when we see a patient that we're doing scaling and root planning on, we like to do the ozone water and then the gas at the end. So for the water, we got this out of the generator, so it's still active. We go and we just fill up a syringe with the ozone water.
So you're going to fill up your syringe with the ozone water. You're going to add on a needle tip. This is a blunted tip. Then you'll stick the bevel into the pocket. If this tooth had a pocket, it would easily go in. You're going to irrigate with the ozone water. Like we said, it's better than irrigating with the chlorhexidine gluconate that you usually see with these types of procedures. Next, since the water attracts the gas, you're going to then do the gas after you do the ozone water. So same thing, you're going to insufflate with the ozone gas. Once you push it into the pocket, you'll see it bubble up a little bit. This is how you know you did it successfully. Types of bacteria that cause periodontal disease are anaerobic bacteria, meaning that they don't like oxygen. With ozone periodontal therapy, you are creating a high oxygen environment that these types of bacteria cannot thrive in. This treatment is natural and free from side effects, making it the safer periodontal treatment.
In our office, to keep our chairs and other parts of our office clean, we use ozone water.
Ozone is an oxidizing agent that can be in liquid form to create a biocide that destroys bacteria and viruses. Key tip, it also doesn't wear down the chair material like the harsh chemicals in cavity wipes.
One more use for ozone is that we add it to our bottles that attach here to our units. And once we put some ozone water mixed with some other regular water, we put it into our units, which then go through here and through our electric scalers, which give our patients an optimal clean. Alright guys, so that's all I have for the uses of ozone. It's a great treatment to utilize and to add into your practice, and hopefully you learned something today, and that's all we have on ozone.